Good afternoon. Thank you all for being with us here today, especially to Louisa's family and parents, of course. My name is Shabnam Saleh, and I am the inaugural director of the Governor's Office of Healthcare Affordability and Transparency. A mouthful, I know, but our mission is critically important. The Governor established this office back in 2020 to lead the administration's mission of improving healthcare affordability and accessibility in New Jersey, with a special focus on stabilizing and lowering costs in the long term. Our team, colleagues across departments, especially those in banking and insurance, and Commissioner Zimmerman and his team, and in the Governor's office, work every day to help more of our state's residents and families access the high-quality health care all New Jerseyans deserve, and at some of the world-renowned institutions we know we have right here in our state. With the Governor's support, our office has played a critical role in advancing prescription drug affordability and transparency, work aimed at mitigating the unsustainable rate of healthcare cost growth, introducing new consumer protections against predatory medical debt, and more. And I want to touch on something briefly before I introduce the Governor, whose tremendous leadership has allowed us to successfully move forward on so many of these policies, many in partnership with our strong champions in the legislature and our advocates. So much of the progress our team has achieved over the years, especially with one of my dear colleagues, Ed Doherty, in Council, and so many others, has been made possible by the public servants, many who work behind the scenes of government. The people who, whether in the administration or in the legislature, and I see Mark Iaconelli here today, take the lead and explore different solutions to create meaningful policy and reform. Louisa Carman was one of those public servants. She worked hard to protect New Jersey's families against medical debt and get us to where we are today. Together, Louisa and I brainstormed back and forth, researched models across the country, analyzed every piece of data we could, spoke with experts in the field, and more. She had a hand in so many of our office's accomplishments during her time in public service with us. She was at the very beginning of her career, but even so, she undoubtedly impressed her colleagues and made those who worked with her happier and grateful to have known her. When Louisa came to me in one of our early conversations about her law school application process, we discussed the areas of study that she might be most interested in. I was proud when she indicated that she wanted to stay involved in healthcare policy. I was even prouder when she said she was particularly interested in policymaking at the state level because she saw firsthand how impactful and how possible it was to make significant change in a quote-unquote reasonable amount of time. We talked about how long it can take to the trajectory of federal policy. And we talked about how our governor and this administration, with the help of our partners in the legislature, has done more in healthcare affordability and more quickly, in my humble opinion, of course, than many other administrations combined. We miss Louisa dearly, and she will always be in our hearts. She made such a meaningful impact with her passion, dedication, and work ethic, and her bright, albeit very new career in public service. And with today's bill signing, her passion and dedication to our office's mission will live on forever with the Louisa Carman Medical Debt Relief Act. I now have the honor of introducing my boss, the Governor, who has said yes passionately to so many new healthcare ideas and policies over the course of his term, and who regularly reminds us to focus on policy and not the politics. Please join me in welcoming the 56th Governor of New Jersey, Governor Philip Murphy.
Thank you all. Thank you, Shabnam, and good afternoon, everyone. Thank you for joining us today as we sign a historic piece of legislation that will make our healthcare system more accessible and more affordable for more families all across New Jersey. And I want to thank right up front all of the advocates, activists, patients, and lawmakers, and we'll hear from a couple of them in a few minutes, who made today's victory possible. Starting with the woman we just heard from. I always used to kid her, and I'm going to kid her again about the name of your office is, you couldn't fit on the side of a tractor trailer, but she's a wonderful leader, the director of New Jersey's Office of Healthcare Affordability and Transparency. Let's hear it one more time for Shabnam Saleh. And you have been tirelessly dedicated to making this legislation a reality, along with everything you do to support our state's patients and families. In the 4 years since we launched the office, it's hard to believe, your team has helped lower costs for everything from health care insurance to prescription drugs. And our state is incredibly grateful for your leadership as well as that of your colleagues. James Lloyd, where are you, James? You here? I don't see him. And the aforementioned Ed Doherty. Ed, are you with us? Okay. They've taken not with us, but Ed's in our counsel's office. And I want to thank them as well in working to ensure that every New Jerseyan can access high-quality health care without breaking the bank. I also want to thank especially our legislative partners who helped get this legislation across the finish line, many of whom are with us today. And we're going to hear from the first two, Senator Shirley Turner and Assemblywoman Verlina Reynolds Jackson. Thank you both. We're in your backyard here in your district in the great Trenton, New Jersey. I also want to thank Dr. Herb Conway is with us, Wayne D'Angelo, Anthony Varelli, and to the many others who are not here who helped push this over the goal line, including Senate President Nick Scutari, Assembly Speaker Craig Coughlin, and Majority Leader Teresa Ruiz. Along with our friends with New Jersey Citizen Action, NJ Appleseed, and the many organizations, as well as patients and their families who advocated for this legislation since the very beginning. I also want to acknowledge our terrific, the one and only Lieutenant Governor Tahisha Way. I want to again re-acknowledge Commissioner of the Department of Banking and Insurance Justin Zimmerman and the First Lady of the great state of New Jersey, Tammy Murphy. And finally, and most importantly, I want to extend my deepest gratitude to the members of Louisa Carman's family who are with us today. We just spent some private minutes together. Her dad, Glenn, her mom, Ann, sitting right behind Verlina and Shabnam, respectively. Cousins, Ellen and Fenna. I don't think Adam is here yet, is he? Adam, nice to meet you. Where are you in life? In D.C. Honored. I'm sorry about the train. I was told by one of your cousins that it wasn't one of ours, so I was happy to, honored to meet you. And also to Brother Evan, who could not be here today, to Louisa's guy, Vitor, who's in Europe. I want to give them a shout out, and all the many other cousins. I was led to believe by the family that these are the representative cousins of many more. So God bless you all. And to each and every one of you, let me say thank you for being with us, and God bless you all, and God bless Louisa's memory. As Shabnam mentioned, this landmark, and I would argue life-changing piece of legislation simply would not exist today without the vision, the passion, and the dedication of Louisa Bradlow Carman. Since the very first day that she joined Shabnam's team back in 2021, I believe, she poured every ounce of herself into building a stronger, fairer, more accessible, and more equitable health care system for New Jersey. And this legislation is truly the culmination of her years of devoted service to our state. I was saying to her family privately, we name a lot of things after a lot of people. And I would say Shirley, Verlina, their colleagues would agree. For the most part, those are deserved. But this one is literally, this woman put a bunch of boulders on her back from day one and walked straight up a mountain to get this thing done. So this is so, so richly deserved to be in Louisa's name and memory. It's exactly why I mentioned during my State of the State address earlier this year, I called on our partners, and I want to thank them again in the state legislature, to not only send the bill to my desk, but to name it as well in Louisa's honor and memory. And though our hearts remain broken that she is no longer with us, this law, the Louisa Carman Medical Debt Relief Act, will always stand as a testament to the indispensable role that she played in transforming New Jersey's healthcare system for the better, and I cannot underscore that enough. In the years to come, families up and down our state will be able to access the care they need and sleep easier at night because of the reforms included in this legislation. It will protect generations of New Jerseyans from falling into medical debt and facing the risk of financial ruin. And frankly, that has never been more important than it is today, because there are, as we speak, hundreds of thousands of New Jerseyans struggling with crushing medical debt. In fact, right now in New Jersey, more than 1 in 10 of our neighbors has medical debt in collection, and that number is even higher in black and brown communities. This growing crisis does not only threaten the economic well-being of our state's families, it also poses a threat to their physical health and well-being as well. Why, you may ask? Because we know that when someone is already saddled with medical debt, they are far less likely to seek out medical care in the future. They worry about being harassed by predatory medical debt collectors who, by the way, may garnish their wages or even seize their property. In other words, if someone who is already struggling with medical debt sees a warning sign about their health, they may avoid seeking help altogether, and as a result, they put their life needlessly at risk. It's dangerous, it's reckless, and it's wrong. So let us set one thing straight. Here in the wealthiest nation in the world, nobody should ever have to worry about being able to afford critical or potentially life-saving health care, period. And with the Louisa Carman Medical Debt Relief Act, I know Shabnan was involved in naming this act because it's got 18 words in it. Louisa Carman are the only two that matter in this case. We are going to take a monumental step forward in ensuring that our state's families can seek out the care they need and when they need it without facing the risk of financial calamity. And importantly, this legislation represents the latest step forward in our administration's broader commitment, with the help of Shabnan and Louisa and Shabnam's team and our legislative partners, again I want to thank them, to making New Jersey's healthcare system more affordable and more accessible. Over the past 6.5 years, we have meaningfully lowered the cost of health coverage and helped more New Jerseyans than ever before sign up for health care insurance for the first time. And I want to thank Justin and his colleagues at Dobie for their leadership. In fact, just last year, nearly 400,000 people enrolled in a plan through Get Covered New Jersey, which was a record high. Additionally, and thanks to the leadership, again, of our friends in the legislature, we have also enacted one of the most comprehensive prescription drug price affordability and transparency legislative packages in the entire nation. With these reforms, we are capping out-of-pocket costs for critical and even life-saving medications. We've strengthened oversight over the companies that manage prescription drug plans, and we have also promoted greater price transparency across the entire pharmaceutical supply chain. Moreover, with last year's budget, our administration made our first ever investment into combating medical debt with $10 million in new funding. And that was money that was well spent, because for every dollar invested into this effort, we can retire up to $100 in medical debt for tens of thousands of people. And then today, with the Louisa Carman Medical Debt Relief Act, we are making our boldest move yet in protecting New Jerseyans from predatory medical debt collectors. This law will reform the medical billing process so that no patient receives a bill while they are still recovering in their hospital bed. It will also keep medical bills out of collections for longer, so families have more time to seek financial assistance or even appeal a charge. And this law will also ensure that medical debt cannot be reported to credit agencies, which will help prevent overdue medical bills from dragging down a patient's credit score, which can then in turn hinder their ability to get a job or to buy a home or to do other things in life. So in short, the Louisa Carman Medical Debt Relief Act will bring dignity to the medical bill payment process. It will keep more of our state's families out of debt, and it will provide patients the time and the peace of mind they need to fully recover. But above all, this law will help ensure that no family in New Jersey has to choose between seeking potentially life-saving care or falling into a medical debt trap. So with today's bill signing, we are recommitting ourselves to building a health care system that prioritizes patients over profits. And that is exactly the type of healthcare system that Louisa Carman envisioned, not just for New Jersey, but for our entire nation. So once again, I'm deeply honored, especially to stand with the family of Louisa for this opportunity to commemorate her legacy with a law that will improve the lives of millions of New Jerseyans for many, many years, if not decades to come. And before I turn the podium over to my dear friend and great leader, Senator Shirley Turner, I want to mention that naming this law in Louisa's honor is not only fitting because of all the work that she poured into making its reforms a reality, this law is also a fitting tribute to Louisa because, as Shabnam mentioned, she had hoped to pursue a career in law, and as we discussed with her family. I understand that she was even planning, I think, to start law school as early as next month or in September. And tragically, we will never have a chance to see Louisa become the brilliant, motivated, and passionate lawyer that we all know she would have been. But with this act, her brilliance and unwavering dedication to serving our most vulnerable neighbors will be eternalized as part of our state's history and its legal system forever. And together, we're going to do everything we can possibly do to continue building upon Louisa's proud legacy and ensure that every family in New Jersey can access the health care they deserve, no matter their economic status. Again, I want to thank everyone who made this legislation possible, and thank you all for being here today, especially Louisa's family. With that, please help me welcome one of the amazing sponsors, Trenton's own outstanding leader, Senator Shirley Turner.
Good afternoon, everyone. First, I'd like to thank the family of Louisa Carman for being here today as we recognize her amazing, inspiring legacy. Louisa's work and research laid the foundation for providing financial relief from medical debt to millions of New Jerseyans. As we all know, Louisa was one of a kind, and we are deeply grateful for her service to the public and thankful that we can carry on her memory and purpose in such an impactful way. I also want to thank Governor Murphy for his leadership in alleviating medical debt for our residents. 2 years ago, Governor Murphy initiated efforts to relieve the crushing debt of medicine costs and have eliminated the barriers to financial stability for too many of our families here in this state. Medical debt is an unfortunate burden for more than 1.5 million residents, many of whom are now adding the important layer of protection from extreme billing and collection practices that unfairly target individuals who have been struck by illness or medical emergencies. The financial burden of health care can also lead to an individual to, as Governor Murphy said, forego health care. No one should ever have to live in poor health because of the debt that they incurred in taking care of themselves or their families. I join everyone here today in thanking you, Governor Murphy, for bringing this issue of medical debt to the forefront of the agenda of our state. And I also want to thank all of the legislative sponsors who supported S-2806 and to the many advocates and organizations that made this historic landmark legislation law. I am confident that we will continue to empower residents and provide our citizens here in the state of New Jersey with healthier and more financially secure futures. Now, we don't know unless we have incurred some kind of health care costs in this state. And it's not just in this state, it's across the country. The skyrocketing cost of health care has devastated the budgets and lives of so many people in this country, and also right here in the state of New Jersey. No one can sleep at night knowing that they owe as much money as they do to pay off these debts. And it impacts not only their mental health, but their physical health, and also it hinders them in terms of getting employment, jobs, as well as getting loans, and also it impacts them in terms of being able to meet the cost of automobile insurance. And of course, everybody wants to be able to have a home and a mortgage. This medical debt can prevent them from getting mortgages as well as car loans, and they pay dearly, more than what anybody else would pay because of this debt. And as the governor indicated, it will protect our residents who have this unfortunate debt through no fault of their own. They will be protected from these debt collectors that hound them day and night. So for all of you here today, thank you for coming out and making this day possible so that we in New Jersey can be in the forefront of stabilizing the people in our state today. New Jersey is a great place to live, and we want to keep everyone healthy and stable financially. Thank you very much.
Senator, that was well framed, and thank you for that. And as you rightfully point out, we're not an exception. This is a national challenge, and I love the fact that we're taking steps like the ones we're taking today to push back on it. So God bless you and thank you. Again, there are some outstanding legislators with us today, but speaking on behalf of the sponsors in her chamber, again, Trenton Zone, please help me welcome another outstanding leader, Verlina Reynolds-Jackson.
Good afternoon, everyone. And again, I want to thank Louisa Carman's family for allowing us to continue her legacy. And protocol has been established. You know, I think this is what a good example of what good government looks like. When you have the legislature, you have both the houses, the Assembly and the Senate. But these issues don't just come up. They affect people. These are real people's lives. And anyone who has ever faced the burden of a healthcare crisis immediately followed by overwhelming medical debt knows how extremely life-challenging how it can be afterwards. And so far too long, the burden of medical debt impacts uninsured people, parents, and those in lower incomes. And yes, even people with insurance also face medical debt. Many of you don't know, but I have Crohn's disease, and I've had it since the early 90s. Looking back, I can see that every 10 years I have a crisis, and it requires me to go to the hospital. I remember I was early on in my career. I had just gotten a job, and I had a flare-up. I had internal bleeding. I was still living at home, and my first thought was like, I gotta get to the hospital. My second thought was, does my insurance cover ambulatory services to the hospital? And my mom said, we gotta go. We don't have time to talk about this. Let's just go. So I went to the hospital and I did all the testing, and I knew I needed to have surgery. And so I said, well, did you contact my gastroenterologist? And they said, no, he's not affiliated with this hospital. So now I'm like, okay, crisis. I need to get to his hospital because I want him to do the surgery. And I just kept thinking to myself, like, are you nuts? You're thinking about all of these things, and you need to be focusing on your health care. But I was in the process of buying a car. I wanted to buy a house, and I started thinking about how my credit score was going to be impacted. It was just crazy. It was unbelievable, but it's true. Many things are determined by your credit score, and we've heard it. It's your mortgage rate. It's your interest rate. It's if you can get an apartment. Can I get a car loan at a decent rate? How is this going to affect my homeowner's insurance or my life insurance policy? Employment also checks your credit scores. What about my student loans? If I want to go back to school, what is that going to look like? Even if you're a co-signer, your credit score is still evaluated. So I don't have to imagine what this feels like. I live this. I have lived experiences checking my insurance, making sure it's paid. How much do I owe? What do I need to budget to get to the next phase? So I've lived through this, and so I have to say that no one should have to go through this. So I'm really extremely grateful to Governor Murphy for signing this, for Louisa for having the forethought that these issues come from the community, and it's from the community to the Capitol that we're here today. We're here making legislation that's going to impact thousands and millions of people here in New Jersey, and so I'm eternally grateful. Thank you, Governor. Thank you to our allies and our advocates that have gotten us to this point. We've did meetings on the weekends, Sunday calls. Our staff is tremendous, and so I say thank you to anyone that put hands on this bill so that we can continue the Louisa Carman bill, the medical debt bill. Thank you so much.
I just said to Verlina, it was incredibly powerful. You know, if you're not careful, some of this stuff can seem abstract, but it's real. And Louisa Carman got this over the goal line, and that's real. Verlina, thank you. With that, I'd love to invite the folks up who think they're getting a pen to join me, so I sign this into law. If you come up and you're not getting a pen, I'll say something subtle like, not so fast.
I almost guarantee you I'm in the back.
Yeah, you got a couple more? A couple more. You find a couple more? Can you do that soon? Yeah. Okay. Conway's in the house. Soon to be Congressman Herb Conway. Today is 22nd. Thank you. Wayne D'Angelo, Assemblyman Wayne D'Angelo. And Assemblyman, also we're in his district, Anthony Morelli. Yep, we're right here. Okay. A pediatric cancer survivor representing the Leukemia and Lymphoma Society. Let's hear it for Andrew Sirleaf. Take this off. Come on in tight here. I'm going to do a picture. God bless you. How old are you? All right. So you're going into what grade? Fifth. Whoa. I'm going to teach you Mr. Lester Yaffe. I hope you There you go. Please also acknowledge and help me from New Jersey Citizen Action, the Healthcare Program Director, Laura Waddell. Also representing the Leukemia and Lymphoma Society, another cancer survivor, Amanda, I hope I get your name right, Amanda Schlesier? Schlesier. God bless you. All right, let's one more time. Amanda says please help me welcome the Executive Director of New Jersey Appleseed, Renee Steinhagen. Ganz Deutsch. Is that true?
I am.
Where were you from?
Well, I reclaimed my citizenship because my father was a refugee.
Oh, okay. From where, do you know?
Berlin.
Berlin, we were just there. And last but not least, representing RIP Medical Debt Charity, songwriter, customer, Andrew Gregory. Andrew? You know what? Justin Zimmerman is there. He did a hell of a job. Justin, this one's for you, buddy. Honored to say, allow me to stand here if I may, that the Louisa Carman Medical Debt Relief Act is now the law of the land. Thank you all. Don't lose this.
You're always welcome.